So we're gonna do our liver. We start in sagittal. We go sagittal left lobe to sagittal right lobe, and then we go back and do transverse left lobe, transverse right lobe. So we are going to start in that sagittal transducer position in that midline epigastric. That's going to put us in the position for our sagittal left lobe. Our liver sits in a position like this, right? It's a triangle, and that left lobe is going to start pretty much all the way over here in some people, and that right lobe is going to go all the way down over here in some other people. So it's taking up this entire region of our abdomen. So we're going to be moving around and adjusting our transducer quite a bit to look at this organ. So we start right here, sagittal transducer position. It's going to give us our sagittal left lobe. I'm moving up pretty high on her. As you can see, we're cutting off a little bit of this left lobe tissue, so we want to scoop up, and we're going to get that to come into focus here. So we're seeing more of that tissue there. So I'm pretty high up on her, even almost towards her chest. So here we have our sagittal left lobe. We're cutting off a little bit over here. We can move down to get some images of this, the tip of our left lobe. Move up to get that border, that superior border up here. And we just want to sweep side to side in sagittal. So here I'm sweeping out to her left side. So I'm looking at all of this liver tissue that's heading that way to the left. And then I'm sweeping back in. I'm going to get back to that midline, and then I'm sweeping to her right side, getting more of this left lobe tissue, and then that is eventually going to put us into our right lobe. So our left lobe, just that small section of tissue, but we want to be sweeping left to right, making sure we get all of it. So for our images, we would take one like this, showing that triangular band of tissue. Big breath in and hold. Getting our nice triangle piece of sag left lobe. Sweeping in towards her right side, towards the midline. We're going to see our hepatic coming in, but we're also going to see our aorta here posterior to the liver. If we sweep in a little bit more, we're going to see her caudate lobe. You can breathe, Meg. I know a lot of us had some issues defining this from the PowerPoints. It's very discreet. We use our ligamentum venosum to help us differentiate that. So this bright white echogenic line here, that's going to separate our left lobe from our caudate lobe here. So it's very discreet and it's hard to see, but when we live scan, it's a little bit more obvious. So big breath in and hold. And we sweep through that, and just watching this area, we see our aorta, we sweep in a little bit more. That area is becoming a little bit more prominent, and then we get our IVC. So as we sweep through, you can see this little bulge of tissue, and that is our caudate lobe. Breathe. So our aorta, our caudate lobe, and our IVC are all going to be landmarks that we use when we're taking our pictures. So IVC here. And you can tell it looks a little bit different than the aorta because the aorta is going to be more posterior. It's also more towards the patient's left side, so you're angled out a little bit towards her left. It's posterior, it's very rigid and tubular, and it's pulsating. As we sweep in further, we see that caudate lobe, and then we get our more phasic, meaning it's responding to our breathing. It's a little bit wider in diameter. It's not as rigid in its shape. It's also running through the left lobe of the liver and the right lobe of the liver down here. So it's much closer in contact with the liver than the aorta is. You also can put your color Doppler on. That's how we can tell a difference as well. Our IVC is going to have a continuous flow because it's a vein, whereas our aorta is going to be pulsating. So we can see our aorta pulsating there. It's flashing at us. So that's our sag left lobe. We can go down to our sag right lobe. I'm going to keep my hand in the same position, but I'm going to follow the curvature of her ribs. So I'm going to let my transducer angle a little bit, kind of how we did with the sag gallbladder. And I'm going to have her take a big breath in, and we're going to sweep all the way under those ribs. So I'm putting a good amount of pressure, and I have a steep angle on my transducer. We're all the way under her rib cage, and if we keep sweeping up, we get the dome here. We know we're getting the most superior portion of right lobe tissue, and we're coming down back towards her belly button. We have our hepatic's coming in here. We have our portal vein there. We have our IVC coming in, gallbladder. We know that that's a landmark between the right and the left, and we have our right kidney here as well. So breathe, and whenever you're ready, take another big breath in and hold. So let's just sweep through that right lobe again in Sag, sweeping all the way up under her rib cage, coming down. We're going to see those hepatics right there and there. We have our IVC coming in. We know our hepatics drain into the IVC. We have our portal. We have our kidney coming into view, and we have our gallbladder. That's going to be our Sag right lobe. And similar to everything that we have done so far, my transducer is not in a true sagittal position. If we put our transducer in a true sagittal position, we're not really evaluating all of that liver tissue as well as we could. So we're going to follow the natural curvature of her anatomy, and that's going to give us a true sagittal of this organ. So now that we did Sag of left lobe and right lobe, we're going to go back and do transverse left lobe to right lobe. So we're going back up into that same position for our left lobe, that higher upper mid epigastric region. And we know our left lobe is smaller, so we're not going to really have to move as much as we do with the right lobe. So make a big breath in and hold. We're going to sweep up underneath her ribs. We're looking at all of this left liver lobe tissue. We have a left hepatic coming in over here. We have our IVC here. Looking at this tissue. Sweeping down, getting into our pancreas because we know our pancreas sits posterior to the liver. So we're looking just at that tissue here. And here is our running man sign. So this is where the portals converge, right? We have our main portal vein here, and we have our left coming up there. So you can kind of see how they dance together. It looks like a man running with his arms. Hepatics there, draining into the IVC. So transverse right lobe, same thing. We're going to have her take a big breath in. We're going to sweep all the way up underneath that rib cage. Now, instead of my notch being pointed this way for our sagittal, we're going to be pointing down this way. So now our transducer is pointing towards us, towards the patient's right. So it seems a little strange that for Sag, we're pointing it towards her left shoulder, but we're really still kind of keeping it in that Sag orientation to the organ. So transverse, we're going to flip that, and we're going to do the same thing. Big breath in. We're sweeping all the way up under her ribs, up to that dome. Now we have a little bit more of a rectangular shape here instead of a triangular shape, how we saw it in Sag. Our hepatics appear to be coming in on the other side. That's just because of how our transducer is positioned. And now we're getting a nice C shape of the kidney, and we're getting a circular shape of the gallbladder, as we would expect in a transverse position. Just sweeping through that. Okay. And then as for a liver measurement, we do that in a coronal approach. So our notch is pointing up towards her head. We're going in from her side here. So we're getting this oblique view of the liver. We're trying to see how far it extends from this portion of her right lobe down here to the most superior portion of her left lobe up here. So we're trying to get that all in one sound beam coming in from this approach. Imagine if this is a flashlight, we want to see how far that light can travel, and that's how we're going to get our measurement. We're going to get some rib shadowing as expected. We're coming in from the costal position. We're not really evaluating a lot of the liver tissue here. Remember, we're doing this for a measurement. So we're going to measure from that distal right lobe, so down here is where we're coming in this way, to to up here, which is this. So this is how we're measuring her liver. And that's what we're doing on the image. Okay. And then we'll just show you some vessels here. We'll get into Doppler a little bit more at the end of this semester and the beginning of next semester, but just so you can see and reference your lectures, we have our portal vein coming in at the porta hepatis here, our red vessel. We have our hepatic artery right on top. It's traveling in the same direction as the portal vein, so it's going to display the same color map. It's going to be a little bit more pulsatile and a little bit smaller. We have our right portal vein. If we follow that portal vein up a little bit higher, we're going to see it branch down to the right lobe. And that is going to be displayed here. So the right portal vein is going to display blue because it's dipping down to feed the right lobe of the liver. So it's going to change direction in terms of the color map. Now our left portal is going to be traveling up, so same to the transducer, it's going to still be displaying red. So let's see our left portal vein. This branch right here. And as for our hepatics, we saw those nicely in transverse, so we can use the same approach. We can go transverse left lobe, big breath and hold. Now we're getting a lot of this artifact because the hepatics are located so close to the heart, so we're getting some flashing from all of that motion at the heart. So here we can see a really great example of how the middle hepatic joins with the left hepatic before it drains into the IVC. We saw that really nicely. You can see how our middle hepatic here a lot of flash artifact from the heart. Our middle hepatic is joining with that left hepatic right here, right before it dumps into the IVC. So you can see middle hepatic, left hepatic is coming down here, they join right here, and they dump right into the IVC. Here's our right hepatic, that's gonna join with the IVC on its own. So a nice representation of those vessels.